Hi guys, this is Shanice Carrington, Doctor of Physical Therapy, and today's segment is going to be about the cervical spine, aka the neck. So I kind of wanted to start it off with linking it to football because that football season is coming up soon. So here's are some of the common injuries that athletic trainers on the field are going to be looking out for. So the top one is any type of brain injury, any traumatic brain injury. They're looking for brain bleeds, aka called like subdural hematomas. They're looking for any like skin lacerations, any bleeding externally. They're going to be looking for anything that would cause you concern of like concussion or a neck fracture. If it's a fracture, you'll see that they'll immobilize their spine like immediately. If it's a concussion, that's where it becomes like a little more tricky because concussion is a hard thing to diagnose to start off with. But the main thing is if that athletic trainer has any concern that that player has a concussion, they need to pull them off the field immediately. If they were to undergo another traumatic incident to that brain when it's just going through a fresh concussion, you have something that could happen called a secondary impact syndrome, which basically means that the brain is going through like this, almost like this cellular reaction where things are completely out of whack. But you can't see them on imaging. You can't see them on like MRIs or X-rays because what you're talking about is cellular. But if it's not functioning correctly, if cells don't function, we don't function. So you'll have something that's called a secondary impact syndrome where it's one after the other. That's called a metabolic cascade, causes brain function to decrease. Brain function decreasing means bodily function is decreasing, so it could cause death. So that's one thing. Second thing is if there's chronic concussions. Like say somebody had a concussion this year and then they came off the field, they did the right thing, and then next year they have another concussion, and then same thing happens the year after and the year after, and they have these chronic injuries. You can get something that's called CTE, which basically stands for chronic traumatic encephalopathy, which can cause long-term damage. You ever hear like those 55-year-olds that all of a sudden their personality changes and they start becoming violent and mood swings and all this stuff keeps happening? It's all because these proteins in your brain start breaking down. So when that starts happening, it's like we're already going to go through brain degeneration as we age. So now imagine that all the proteins in your brains are no longer functioning as well. Bad things happen with repetitive brain injury, so we're trying to minimize that as much as possible. Okay, but those are some of the big hitters that I kind of wanted to hit on first. Now I kind of want to talk about stuff that you're going to see every day. You don't necessarily need an injury for it to happen. Like the first thing I want to talk about are stingers. You know, when people say that, they're like, oh, I've got a stinger, I'm in a sport, or I was at work and, you know, I have a desk job and I have a stinger. Stingers are just like an acute, kind of like a nerve reaction where either you turn a certain type of way or like it kind of like impinges on a nerve. And normally they go away within like a couple of minutes, couple hours, max couple days. But if it goes on for longer than a couple days and you're noticing like neck pain and pain going down your arm and down your shoulder blade, stuff like that, then that kind of falls to a different criteria of what we call cervical radiculopathy, which is kind of like the next version of sciatic pain, where you can get referral pain down the arms, you know, in the neck itself or down the shoulder blades. So if you're having that and it's going on for longer than a couple of days, like 2-3 days go by and that stinger hasn't fully resolved, that's when you should go follow up and see a doctor. But my caveat to that is when you go to see the doctor, they're going to tell you that they want imaging. They want to get an X-ray, maybe they want you to do physical therapy for 6 weeks and they'll go to get an MRI afterwards. But research is showing us that imaging is not conducive to how you're going to respond to any type of these neck stingers or injuries and neck pain in general. You can have a neck that has herniated discs, bulging discs, degenerative discs, stenosis, like everything in there, and they have absolutely no pain. But you also might see the vice versa of that. You might see a neck that's normal and everything looks fine, but people are having this pain that they're like, well, my imaging looks fine, because the two don't correlate. So when you go see a physical therapist, we'll look at your imaging, but that's not what we're basing how we're going to treat you as, because we basically put people in criteria and then we treat them based on how they present, not what the imaging is showing, because it's just not reliable. So granted, there's a lot of things that you'll see, like I'll go over in a future video what disc herniations mean and what stenosis mean and degenerative disc disease, stuff like that. We'll go over what that stuff means in a nutshell, but just know imaging is not everything. And I wanted to give you guys like a few little tidbits of stuff to work on. Either you have neck pain and you should be seeing a doctor because it's been like a couple days and it's not going away. Remember what I said before. Or you want to do preventative treatment, things you should make sure to work on. You want to keep your neck muscles nice and loose. So you want to make sure that your head has good rotation. You should be able to look up. You should be able to look down, side bends. You can just work on some generalized neck stretching in general. And if you're going to stretch your neck, you should also be stretching your thoracic spine. We have our neck, we have our lower back, and in between the two, we have our thoracic spine. A lot of evidence is pointing on having good thoracic mobility. So whether it's like foam rolling or like open book thoracic stretches, which again, I'll go over in another video, make sure to keep your neck nice and loose and flexible and keep your thoracic spine nice and loose and flexible, okay? And the last thing I have to say is posture. Posture, 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 posture. So much of our pain is dictated by a postural dysfunction. So especially the desk jobs, like the teenagers, like this is gonna get us every time. So as much as you can, try to make sure you keep your posture upright. Try to work on those muscles when you're in the gym. So neck, thoracic mobility, postural strength, okay? The last thing I wanted to finish off with is I wanted to talk to you guys about when I want you to see a doctor, right? There's things that are like normal, everyday orthopedic injuries, and there's stuff where you just wanna make sure everything is going kosher. So when do you see a doctor? If you are having, especially if you've had trauma before you're noticing stuff like this, like a neck injury, motor vehicle injury, anything like that. But even if you're not having an injury, things I want you to kind of put a little bit of a, exclamation point on is if you have a sudden acute loss of muscle strength, like you're dropping things out of nowhere, you can't lift something that you've been lifting your whole life, little things that kind of are new, maybe you want to see a doctor. If you're getting numbness and tingling down both arms, not just one arm, maybe see a doctor. If you're noticing a sudden imbalance, a gait and balance disturbance out of nowhere, not a bad idea to see your doctor. If you, especially if you had a head trauma and you're noticing that it's hard for you to like hold your head up and you almost feel like you want to hold it with your hands to keep your head upright, go see a doctor. If you are having any deep and nagging neck pain or almost like a localized headache that's worsening and not getting better in time, and it's almost turning into like an indescribable pain, like something that you've never really felt before, and it's significantly getting worse, go see a doctor just to make sure everything is okay there, especially if it's not responding well to any over-the-counter medication, okay? I'm sorry, I know this was a long video. It is hard to put the whole neck down in like X amount of minutes, but this is like a big overview of everything we could possibly see in the neck, especially from athletics down to like everyday stuff. So again, we'll go further into these topics as we go along, but that's the beginning of cervical spine. Thanks, guys.